Welcome, and thank you for joining the ASPPH Presents webinar, How Students Can Get Involved Now. My name is Tracy Seward. I'm the Senior Director of Outreach and Recruitment for ASPPH, and I'm excited to moderate the session today. Public health provides the opportunity to lead a fulfilling professional life, positively impacting communities around the world. If you're considering the field or currently studying public health, then today's webinar is going to help you understand what opportunities are available to you now and after completing your master's degree. This includes discussing some of the many interest areas that intersect with public health, as well as opportunities to explore and get experience in the field now. You do not need to wait for the Q&A session to ask your questions. We encourage you to enter the question at any point during the webinar by clicking on the Q&A button on the bottom of your screen. Today's webinar will be recorded and available online shortly after we conclude. And now it's my honor to introduce our speakers for the day. First, we have Dr. Eyal Oren. He's the Interim Director at the School of Public Health at San Diego State University. Next up, we have Wilma J. Wooten. Dr. Wilma Wooten, she is a Public Health Officer and Director of Public Health Services at the County of San Diego Health and Human Service Agency. Finally, we have Ashley Vaughn, who recently completed her MPH and is an instructor at the Oregon State University College of Public Health and Human Sciences with Health Promotion and Health Behavior Department. All right, with that, I will turn it over to Dr. Oren. Thank you.
Thank you so much, Tracy. Hello, everyone. It's a pleasure to be here and I guess to meet you all virtually. So again, I direct the School of Public Health at San Diego State University. We're a school with about 600 undergrads, about 250 master's students, and then a shared doctoral program with about 70 doctoral students. And what I want to do is tell you, I guess, a little bit about my perspective on the importance of public health at this moment, knowing again that some of you are already in the midst of it and some of you are thinking about public health as a career. And then really to talk about more specifics in terms of kind of how you can potentially get involved, what you can do if you're not already aware. And I know the other speakers also will provide some thoughts from other perspectives and other sectors. So really I'll be trying to give this to you as sort of a maybe the 10,000-foot view from someone at a university, as someone who's working on that curricular side and the training side of our future public health workforce. So I want to say, first of all, and I've said this before, not to this audience necessarily, but I'm going to keep saying it again, certainly during our pandemic, that this is a public health moment. And it continues to be a public health moment for better or worse. And what I mean by that is that with this pandemic, there is just so much opportunity for us as public health professionals to contribute. There's so much opportunity to actually have an impact. And I would have said it before, that no profession has had more of an impact on improving lives in a big way than public health, but I will really say it now. So even before COVID, we face tremendous challenges, right? We have other emerging infectious diseases, foodborne illness, overpopulation, climate change, you name it. There are a host of issues. Actually, I'll add to that list racism, but gun violence, these issues that are forefront in our even political sphere that public health is tackling and is charged with in a way. And these are these kind of grand challenges. They're never probably going to go away, but our role and our goal is really to find ways to engage and to find solutions, right, that are sustainable and that can work for us. So we try to deliver clean water, to make healthcare affordable, to stop infectious diseases like COVID, to create a more livable world. And I will say, I hope, including some of you here, what I've seen is that everybody sort of wants to be an armchair public health scientist. And of course, that's wonderful. We love the exposure. I'm an epidemiologist. I love the fact that people now know that I don't study skin disease, right, or skin cancer, that it's not dermatology. On the other hand, I think there's great importance to proper training and coursework, and there's really a lot of rigor that goes into our training, as many of you know, so that when you choose public health, you're really in it for the mission and the vision, and also just understanding, you jumped in, you're now dedicating yourself to solving these problems. So a couple of things I want to mention that are really unique to public health. The first is that we work on prevention. We are not, while during a pandemic, you could argue everything is sort of a response mode. Really, the way we are trained to think is in terms of preventing things, stopping them before they begin, being proactive, figuring out how to do our work in a way that we can minimize future morbidity, illness, or mortality, death, and other things, quality of life, whatever it is. Given that, it's a very difficult job, right? Because if you do your job well, then you don't see those bad outcomes, and people are kind of happy, but they don't really realize what work you've done. And I know that Dr. Wooten can probably speak to this very extensively, but I think that's an important key point. It's a very different kind of job, let's say, than a doctor who's maybe tracking an ailment or dealing with a specific ailment, because we want to eliminate that ailment to begin with. And we often talk about upstream causes, upstream social determinants, things like that, because we really want to think in a very, very big way about what might impact the things we're seeing. The second piece I want to note is that we, as opposed to, again, medicine, I shouldn't generalize, but often what we see in the medical world is dealing with individuals, with individual patients. In public health, we typically work with populations. We look to work with entire communities. We look to work with entire groups of people and figure out how to make their lives or our lives collectively better, right? So if a neighborhood is impacted by some toxic spill, we work at that neighborhood level, and that's difficult, right? How do you do that? How do you engage a whole community? How do you work with a whole group of people? And so the third piece is really around that collaboration, the partnership. We, in order to understand what's going on, those root causes and those bigger policy challenges and impacts, we need to work with broad partnerships. And that's no more, really evidenced right now when I work with COVID, where we have to work around very, very broad coalitions to make things happen and to make sure that, there are positive outcomes and equitable outcomes for people. So public health at this point has a long history of successes and failures, but I'll note some of the successes, and we can talk about some of the other things in another time. Because of public health, we no longer have smallpox. It's in fact the only human disease we've been able to eradicate, and that you could argue maybe is the failure side, but it's a very challenging thing to do and very politicized. Often war that comes in where you can't eradicate things like polio. We've been trying, we're close. So that's pretty amazing, right? When you all probably do not think about smallpox in your daily lives as something to be worried about. That was not true a few decades ago. We have clean water in much of our world, not everywhere, but we know how to get drinkable water. We've figured out that seatbelts work. We've figured out that helmets, right, help to save lives on bikes, motorbikes. We've, in the United States, moved very quickly towards smoke-free environments. And in fact, we've seen, in general, a huge increase in life expectancy. In the past 100 or so years, a little more, we've seen a jump in life expectancy of about 30 years. So that's really impressive, and that's really thanks largely to a lot of these public health efforts, some of which I mentioned. That said, we've got a lot going on. We've got COVID. So right now, that's what everybody's thinking about. We may be thinking about it for a long time to come. And we have to figure out how to both deal with this, right, mutating virus, how to deal with vaccination concerns or people who are not vaccinating, how to now figure out what to do if we do in terms of boosters, for example. So I think that's first and foremost in everyone's mind, but we also have other things, right? We've got a planet that can only support so many people, perhaps. So how do we deal with increasing urbanization, increasing population density? What do we do with an aging society? What do we do with warming climate? What do we do in terms of just more diverse communities with different kinds of health needs? And again, how to ensure that equitable health response. So I could go on and on, right? But there's really a lot that can be done in those regards. And public health really has a big role in that. So let me talk a little bit about sort of what I think are some amazing kinds of things that students can do. For one, what I've seen on university campuses are that students either with the help of the administration or despite come together and create community and create organizations. And on our campus, for example, we have 3 student organizations dedicated to public health and they seek to improve health, eliminate health disparities. They put on different events, and I think that's a wonderful way to work through things. That's probably not enough. So in addition to that, we also see a lot of opportunities right now to collaborate, for example, with our county. We have more than 200 students from our institution that were placed in internships during the time of COVID, that were even COVID related or somewhat related, and to work with field partners. So typically, as an undergraduate or graduate student, you will have opportunities to engage in internships and in different field practice opportunities. I highly, highly recommend that you do those and find those ones that are meaningful to you. Sometimes those are paid, sometimes they're unpaid, but there have been a plethora of opportunities that I've seen, at least locally, to do those kinds of things. And more broadly, I would say that means getting out there and getting experience. So that might mean if you think you need more research experience, reach out to some mentors, reach out to your faculty, and figure out how to get involved in a research lab. Again, sometimes paid, sometimes not. You have to decide what's worth it to you. Where are you trying to go with things? The other things I've seen are more opportunities for students to instruct, to get on as TAs or instructional assistants. Those are wonderful opportunities to understand kind of the behind the scenes, how this all works, how this all comes together. And then I'd say even kind of more broadly, it's getting involved in terms of advocacy. There are many, many student organizations out there. And again, I'm happy to take some Q&A later about terms of some ideas, but there are always student roles or student opportunities. And those are really good ways to see the bigger picture in terms of what's happening in public health, what are the pressing issues and how you can get involved. And often to do things like publishing through particular journals, through particular societies, or getting more exposure through presenting, through conferences. They may be virtual right now, but so I think I'll stop there as an intro, and I'm going to pass it on to our next esteemed speaker, and then we'll be happy to take questions. So the next speaker is Dr. Wilma Wooten. Dr. Wooten is our Public Health Officer and Director of Public Health at our County of San Diego Health and Human Services Agency, same city that I'm in. So pass it on to Dr. Wooten.
Thank you, Dr. Warren. So I'm going to rapidly go through these slides, and I have some homework for the students, and each slide will indicate what that is, but there are 6 homework assignments. So starting out with the next slide, I just want to give you an overall an overview of what are the functions of public health in terms of, and I shouldn't probably use that word functions because it's going to be used in a different way coming up in the next slide, but the day-to-day activities. So what do we do? So we prevent epidemics and the spread of disease, we prevent, or public health service prevents injuries. Our department prevents and encourages health behaviors, protects against environmental hazards, provides and responds to disasters and assists communities in recovery, and assures the quality and accessibility of medical care or health services. We don't have to provide it, but we have to ensure that people have access. So in 3 words, if you had to say what public health does, it's promote health and wellness, prevent disease and disability, and protect the public's health. Those are the 3 words: promote, prevent, protect. Going on to the next slide, public health is governed by what's called our 10 essential public health services. And this is homework assignment number 1. I don't have time to go into it in detail, but this is just updated by national organizations, including CDC and the Public Health Accreditation Board last September. So there are 10 domains and that span across 3 functions. And the first function is assessment, the second one is policy development, and the third is assurance. So, and we will put in the links in the chat so you can find these, but it's also good, you can just Google it and find it too. 10 essential services of public health. Next slide. So in talking about our government, understanding who is the governing body for a local health department is important. In California, health officers have to be physicians, but that is only in 1/3 of the 2,800 health jurisdictions across the nation. Some jurisdictions have governing bodies that are supervisors, some are mayors, some are city council members. In Houston, Texas, their governing body is actually the lead person is a judge. So it varies from jurisdiction to jurisdiction. But for the city or the county of San Diego, we have 5 board of supervisors that are elected by citizens of our county. And then the business of the county is run by the chief administrative officer, who currently is Helen Robbins-Meyer. And then there are 4 business groups that you see at the bottom. Health and Human Service Agency is one of those 4 business groups, and the health department resides within that business group. And the next slide, these are the board of supervisors. So I think homework number 2 is know who your board of supervisor is based on which district that you live in. You can Google all of these guys and you can find out what are the zip codes for their supervisorial district. Next slide. So as a health officer, I'm an unclassified worker. So I work at the behest of our board of supervisors. So I talked about those 4 business groups for the county, but first, let me start out by saying public health in the United States is organized first at the nation. So CDC is the nationwide health department, if you will. Then each state has a health department, and then each local jurisdiction, tribal, region, territory also have public health jurisdictions. For San Diego County, if you look at the second column, the agency director is Nick Machione, that's his picture, and I am the health officer and current director of public health services. Now, going to the next slide. So this is the nomenclature. This is going to be very fast. Each of the business groups has a director or a general manager. And so that's the nomenclature to describe them. Each group has either departments or divisions. And I'm going straight to Health and Human Services Agency. We have mostly departments where Public Health Services is one of those departments. And within our Department of Public Health Services, we have 6 programmatic branches and 1 administrative branch. So the general managers or people at my position are called executives, and then managers run the various programs across the various departments. Next slide. So the county is operated by what we call a general management system. This is another homework. I don't have time to go into various details, but there are 5 components. Strategic planning, which is 5-year, then operational planning, which is at every rolling 2-year. And you see that in play during the Board of Supervisors meetings every June. So I'd encourage you to go back and look at one of the supervisors meetings. They look at the budget and align the budget or fiscal resources with the various programs. And then we make sure that we're monitoring the various metrics. There are operational plan objectives that are part of our overall strategic plan. And then functional threading, making sure that you're not working in a silo, but working with other departments, because there is a lot of matrix management and cross-department communication and collaborations. And then we ensure that our employees are rewarded for the great work that they do. Going to the next slide, I'm going to skip this next slide because that basically tells you what each of the components that I just described are. Now, Live Well San Diego is a regional plan to build better health, live safely, and thrive. And the next slide, this is a homework assignment number 4. Is to review what Live Well San Diego, don't go next, Live Well San Diego is. It is a region that is building better health, living safely, and thriving. And these three components are achieved by 4 approaches, and you see them there. And the success is measured through 5 areas of influence that are stratified across 10 indicators. And you can, again, Google Live Well San Diego indicators, and every year these indicators are updated and a report is issued. And we work collaboratively with community partners. We have over 500 community partners across governments, across schools, and this is all levels of K through 12 and institutions of higher education, as well as faith-based and community-based organizations and businesses. Next slide. I have 2 minutes left. So strategic planning, very important. Strategic planning now, our countywide strategic plan is stratified across the 4 strategic goals for Live Well San Diego: building better health, living safely, sustainable environments, thriving, and operational excellence. And the next slide, I think this speaks to, we talked about our agency. There are 7 departments in the agency, one of which is public health services. In the next slide, it shows you the various branches that are within our public health services department. As I stated before, 6 programmatic branches, 1 administrative. And the next slide, that's probably another homework, is look at our strategic plan for public health services. It's on our home web page, as are other documents that are very important to the operations of our department. And the next slide, in the couple of minutes that I have left, just move, transition to the next. I want to get to the slide, next slide, next slide. I had a section there about the day in the life of a health officer. No day is the same. In this current environment, we're doing a lot of Zoom calls, but there's a lot of planning, strategizing, and implementation across all of the programs. This is our strategic initiative framework, and it provides the major initiatives that we're working on that are either Board of Supervisor, our CAO, or public health, core public health services. And moving to the next slide, this could be another homework for you because it's online. The last 2 slides are related to what are some of the classifications. So public health competency levels are stratified across 3 groups. Level 1 is the frontline staff, and you see all of the positions there. Level 2 is middle management. These are our supervisors. And then level 3 are executives. I would be an example of that, or any of our administrative managers. Now going to the last slide, this probably is the money slide. These are opportunities that are currently available if you're interested in work study opportunities. We are also including in the chat information about how you can become an intern or a volunteer with the county. So that's in the chat, and I encourage you to take advantage of that. We have a strong and robust pipeline into public health that create future employees and leaders in public health. So with that, I will end my presentation. Thank you.
Hi, everyone. I guess that means that I'm going next. So thank you, Dr. Wooten, for that wonderful presentation. And I'm grateful to be here with all of you today and to gain the knowledge and perspective of both Dr. Wooten and Dr. Oren. They both have done a fantastic job of giving an overview of public health and some of the opportunities that exist. But as a recent graduate, my section of this presentation is really going to focus on how do we navigate those opportunities as students to find the ones that are the best fit. I have 3 key points that I'm going to share with you today, and I'll quickly go through each one. I am a recent graduate from Oregon State University's College of Public Health. My area of study is health promotion and health behavior. So my first tip that I have for you today is that it's really important as you're navigating and starting this career to get to know yourself and your values. The best leaders are the ones that know themselves the best, right? And public health is so broad and can mean many different things depending on the area that you are working. Just because someone tells you that they're working in public health isn't actually that descriptive, right? They could be in health policy, they could be an epidemiologist, they could be working in health promotion. So I think it was really important to me as I started my program to figure out what public health meant to me and how I fit into that picture, because it is a very big picture. Prior to studying public health, I was a high school science teacher. And so entering the program, I had a really narrow view. And it wasn't until I got started that I realized that it is so vast, and I really needed to critically think about who I was and where I fit into that. One book that really helped me focus and to create my authentic career path is You Don't Have to Be a Doctor, Discover, Achieve, and Enjoy Your Authentic Health Career by Professor Oxendine. This book helped me think critically about where I want to go and who I want to surround myself with. And I recommend this book for anyone considering a career in public health. It helps you, each chapter takes you through, asks you a series of questions and gives you some exercises to really define what you want to do in public health. So my next tip on this journey that is related to getting to know yourself is to read as much as possible. I know we're in grad school or in undergrad, right? We're reading so much for classes, but finding books that maybe are outside of public health to help give you some context into how public health also affects these other parts of our lives. So a lot of the books that I chose to read often fell in sociology or data science, but broadening my horizon and getting context outside of the field was really important and helped me navigate the types of opportunities that I was searching for. So when you know yourself and your values, it becomes easier to search for opportunities that align with your future career goals. And then finally, social media can be both a blessing and a burden, as we're seeing in this pandemic. But as new public health professionals, I think that there are some great accounts that you can follow that are guiding all of us along our way. One of my favorites is the Public Health Millennial on Instagram. He does interviews with current public health professionals and just give some really great advice. So I recommend following him there. And then also This is Public Health, which is an offshoot of ASPPH. There's different MPH students from across the country that take over and share their journey and advice for current or prospective students. And following that account really helped me understand where the different opportunities lie for public health students. So then my next tip for you is, this is something that worked for me. It might not work for everybody, but in my program, I felt that it was really important to focus on the skills that I was developing rather than just content knowledge. I will always be a reader. I will always do research looking at the different information that is available, but undergraduate and graduate school is really a time to develop the tangible skills that you can walk away with. So I wanted to be able to leave my program with tangible skills that I could demonstrate in a portfolio that I could then share with future employers. So based on my goals, right, after I learned about who I was and what values I had, I decided the skills that I really wanted to develop were project management, science communication, and data analysis and visualization, all of which are kind of outside of that health promotion, health behavior track, right? And so I was getting the ways to promote health, but I also wanted to make sure that I was getting things done with project management, that I was designing communications that were really effective for communicating science, and then also not only being able to discuss the results of the data, of data analysis, but also do the data analysis myself. So to develop these skills, I looked for classes that were skills-based. Valuing community voice was important to me. So I wanted to learn how to analyze qualitative data. So I found a qualitative data analysis course. I also looked for courses where I could learn R and stats. R and SAS, which a lot of students in health promotion, health behavior, don't focus on that, but it was important to me. And then also project management. So I actually went to the College of Business and took used some of my elective credits to take courses there to make sure that I could do what I say I was going to do. And I decided to focus on these 3 skills by doing informational interviews and networking and hearing about skills that public health professionals use in their day-to-day work. These informational interviews allowed me to hear about career paths that may interest me and what the work actually looked like, right? It's one thing to see on a piece of paper or to read about a career, but it's another to hear firsthand from a public health professional what their day-to-day looks like, the types of skills that they're using, and what they're using to be successful. So the best informational interviews that I completed actually occurred at my state's Public Health Association's annual conference. Many students don't attend these conferences, but I think it is a really great opportunity to network and hear about different paths that you could take as a student. So for example, I live in Oregon right now, and so I attended the Oregon Public Health Association's conference and became a member. That way I stayed up to date on what was happening within this organization, and attending the conference brought people from all over the state, and I was able, to talk and communicate and sit next to people who were doing the work that I hope to do. Additionally, the American Public Health Association hosts an annual conference, and I attended both of those throughout my program. If you're worried about the money to join these organizations and attend the conferences, there are many scholarships available. If you just go to the website of your local public health association or APHA, there's information for students on how to get funded in order to join and attend those conferences. So yeah, look up your local public health association if you're interested in a career in public health, get involved, attend these conferences. In my experience, people love talking about themselves, especially to students that are wanting to join their career field. So come up with 5 to 10 questions that you can reuse over and over to ask people that you meet. What does your day-to-day look like? What are the top 3 skills that you use in order to be successful? Where do you think the field of public health or your area of study is going to be in the next 10 years? And keep track of the people that you talk to. It was through these informational interviews that I found the opportunity to become a data analyst with the Oregon Health Leadership Council and HIT Commons, which is a statewide collaborative. From that opportunity and network, I found my internship. And then I also received a fellowship with Portland State University Center for Public Service. And so all of that stemmed from sparking a conversation at a conference and maintaining those contacts. So conversations and networks can be very powerful, talking to as many people as possible because you never know what opportunities will be brought up. And just putting yourself out there, it can be really scary, but telling people and asking for what you need, and people are usually pretty open to giving you their advice. So my last point on attending these conferences is that there are always opportunities to get further involved as a student at these conferences. For example, my local public health association needed moderators, facilitators, organizers, board members. They needed all of that for the conference to occur. And students can meet so many people by volunteering for these events. And they are often very happy for students to reach out and say, hey, I'm available for these dates. What volunteer opportunities do you have for me to get involved? Additionally, APHA allows you to join different groups to network and collaborate with throughout the year. So I joined the Student Assembly and the Public Health Education and Health Promotion community. And those were really important for me to see on a national level what events and conversations were being had about public health as a field. So that brings me to my last tip. So my tip number 3 is to find a network, right? So you have gotten to know yourself, your values, you've decided what public health means to you and what direction you want to take. Through informational interviews, you've decided on some skills that you want to develop. So then the next thing that was critical to my success was finding a network that shared some of my values and was open to listening to the goals and direction that I wanted to take. In that, don't overlook the office staff and administrative directors in your program as resources. I would not have made it without my administrative director in the College of Public Health. They know of opportunities not only within your college, but also across the university as a whole, and looking at ways that you can get involved with public health related opportunities or what students in the past have been able to do. But So while your professors may be able to tell you about very specific public health opportunities, the office staff can often help you figure out how to get those opportunities funded, or what forms you need to fill out, and what students across the college are getting into. And I think students often overlook that really important connection and relationship that you should have with the office staff and administrative directors. So in addition to the administrative director of my program, my mentor was Dr. Cynthia Mojica. She helped guide me through my entire program and also helped me find organizations that aligned with my goals. I shared with her the skills that I wanted to develop and what my ideal career path would look like. And she really went out of her way to make sure that I had those opportunities. So as a student, I think it's really important to find someone that will also do that for you. And the way you find it is by informational interviews, talking with students who have gone through your program and ask them, which professors are really willing to work with students. For example, Dr. Mojica, I told her one of the skills that I wanted to develop was data analysis and visualization. So she helped me find a project that I could put my skills to use. She helped me receive a grant to promote HPV vaccination at Oregon State University's campus, and helped me find scholarships to fund my studies. And that also led to me becoming a lead data analyst with the Oregon Health Leadership Council. And so it's just these small steps, and where you communicate your needs, communicate your values, communicate what you want out of your program, and finding people along the way that will help you do that. So one more thing I want to add, a really good piece of advice that someone once told me was that as you're growing your network, as you're having as many conversations as possible, it's really important to remember who you talked with. So as you're networking, as you're getting business cards, at the end of the day, put that information into an Excel sheet, right? So write down who you talked with, where you talked to them, their contact info, and then one key takeaway that you want to remember from that conversation. You never know when that information will be important, or maybe you're looking for an internship and you're like, oh, I remember I met this person at the Public Health Association conference, and just reach out and see if they're willing to do a deeper informational interview. And you have all their information right there in that Excel sheet. So that was really important for me to finding opportunities. So one thing, I guess in sum, I'll sum up now and I'll answer some questions in the Q&A. To be an effective leader, to be an effective public health professional, you need to know yourself, know your values, and know your community. And that takes a lot of work, but the perfect time to do that is while you are a student. For me, what led to my success was focusing more on skills during my program, and figuring out what skills were in demand by doing informational interviews. And then finally, finding a mentor that you trust and has similar values to you, and growing your network and keeping track of that network as you go along. I'm really excited that there's so many people here to listen to us, and thanks for your time and the opportunity to talk to y'all.
Thank you so much, Ashley and Dr. Oren and Dr. Wooten. This was fantastic. I know everybody is excited about everything you've presented. There's tons of questions. There's been questions in the chat. So let's go ahead and get started. Ashley, a lot of questions are coming in about how you network with people post conferences, and you were talking about the spreadsheet. Can you talk about your best practices?
Yeah, especially during the pandemic, right? Everybody's email boxes are so full, and everybody's getting so many emails. But I created just a template that said, dear this person, thank you for speaking with me at this conference. It was wonderful to talk with you. Even if you don't have an ask, just reaching out and saying thank you after you have that interaction. I think it was harder. This past year, I attended the Oregon Public Health Association's conference, but it was virtual. And so I did find that was a little bit harder to have those conversations, but don't be afraid after you talk with someone, just to reach out and just say, thank you for taking the time to talk with me, and just remind them who you are and that you hope that you'll stay connected for the future.
Thank you. Another question was coming in about how to find your local resources. So obviously we talked a lot about San Diego and California. You talked a little bit about Oregon, but some best ways to connect with local organizations, especially if they might be international.
This is Dr. Wooten. I'd like to start answering that, and actually a follow-up from the last question. I just take a playbook from when I was interested in sports medicine when I was in college. And I was in Atlanta at Spelman College. So I just reached out. I didn't know this person, but if people are truly dedicated and interested in sharing their knowledge and information, professionals will do that. I get cold calls all the time. I have no problem whatsoever in responding, talking virtually or on the phone, or if they're local, meeting with them. So my thing that I just want to share with everyone is don't be afraid to reach out to people, whether you know them or not. Just reach out and just be mindful of time, and particularly if you ask things, don't ask, if you need something, some population data Friday and you call them on a Wednesday. That's not cool. But never be afraid to reach out just for questions or to ask, get advice from someone that you are aware of and you've done the research on and you feel that they will be useful to your path in your career.
Maybe I can just add one note, which is often schools have kind of their partners, their key partners. And I would just say, if you're already enrolled in a program, your different faculty have key community partners. I'm noticing that we have large COVID testing projects with a county and with other partners. And so that's a really good way to just talk and find out, and you may be interested in a particular, working with a particular group, particular content area, whatnot. So use those resources. I think, just as Dr. Wooten saying, don't be afraid to reach out, whether it's by email or call or whatever it is. Usually people really want to help. That's kind of why we're here. We want to see the next generation come up and do better work than we are doing, and so on.
And Dr. Oren, might I add, when those that are listening become public health professionals yourselves, basically reach back and pull others up. Don't be afraid to share your knowledge and information with them as well. We just have to keep it moving.
So a few questions in here for people that are very new to public health and trying to figure out where they might fit in best. Obviously, public health touches a lot of different areas. So how do you suggest they go about exploring what might be the place to fit into public health?
Well, first of all, we get numerous requests about conducting or students wanting to do internships or volunteers. And the first thing I ask them, what are you interested in? Because I can't tell you what you're interested in. You have to tell me. And then I connect them with our various branches, and then they talk further with those individuals to see what it is explicitly that they could work on or be involved in. So you have to know what your interests are. So I think the first step to take is understand what public health is and what it does and what it doesn't do, because that's very important. And then knowing that, matching that up with your skills and your interests, then you can go to public health professionals and then ask them if you can be involved. But a lot of times, if you just want to be involved in a public health internship, you might learn new things. So just be open for new experiences as well.
I completely agree with Dr. Wooten. I mean, I studied biology in undergrad and Spanish, right? And then I was a teacher. And so my path was definitely not linear to public health. But I think really, like I said in the presentation, this book helped me so much. And he's not paying me to say this. I'm not, this is really, it helped me understand my values. It helped me understand what public health is, what opportunities exist. And there's even templates that you can use to answer those questions.
By the way, Jeff Oxendine was in a prior panel. And so that may be recorded on the website. I'm not sure if the moderators can comment on that, but I think that may also be helpful, given that he's the author of a great book.
Yes, thank you. I will try to look that up and get that in here. And also our This is Public Health Book Club has a recording of that presentation as well. So that's great.
One very small note. I mean, I know there are many questions, but think of where you are. Think of the strengths of the institutions, the issues, the gaps in the public health infrastructure, I guess, or where people are, where their concerns are. We think a lot. We're in the border where we live, so there are a lot of things to consider in terms of working with communities across the border and border health. Other places may have different issues, right? Maybe urban or rural health. And so think about kind of where you live or where you'd like to be. And often it's like, well, I want to be global or I want to be local. Or so there again, the world is kind of right there, a world of possibilities. But because it's a broad field, I think it's really important to start thinking about, well, first of all, what's available to you where you are. But then if you think it's something different, then consider figuring out what that looks like and where you need to go to get.
Just one last tip. Public Health Services, our department provides an orientation for preventive medicine residents every year because we have a preventive medicine residency here. So, and other residencies, family practice residencies, but if you're interested in going through that orientation, it occurs the third week of July every year. We certainly would be interested in having you involved in that process. So that's another way for you to find out about what is public health and be exposed to the various programs that we have and services we provide.
So there's a few questions about vaccine hesitancy in the US and around the world. And is there anything that students can be doing to help with addressing that?
Well, if you have a health promotions department in your institution of higher education, maybe getting involved. They may have plans already in place for outreach and communication and education of their student body. Go to your local health department and ask how you can be involved. We have a youth sector here at the county, one of the 23 different sectors that we've developed out of Live Well San Diego to educate the community. That youth sector was involved in a outreach education campaign where we recently awarded 7 recipients, platinum, 3 gold, and 3 silver awards on a video or an education outreach tool to reach their peers. So there are many ways. Again, don't be afraid if you're interested in something like that, calling the communications department in your local health, your health jurisdictions. So there are numerous ways to get involved.
Yeah, without getting into too deep into kind of how health communication works and sort of what the optimal strategies are, certainly communicating as a loved one and somebody who's kind of trusted with other people is we know has great benefits and strengths. So if you explain things and understand kind of the issues at hand that's coming from you as somebody who may be in public health, people may be more inclined to listen again if they know you personally. But there's a lot more to it than that, I'd say, in terms of possibilities, but that's certainly one thing anybody can do.
There are a lot of questions that are similar and distinct, and it's all about the intersection of public health in different areas. So people are asking from dentistry and environment, sports. So what's the best way to figure out how public health intersects with a different discipline, regardless of what the interdiscipline?
Well, 2 points I'll share with you. Often when I give presentations to this, the preventive medicine residency, I have a slide that I challenge them to identify. There's nothing that you can identify that doesn't have a link to public health. And usually when we talk about the link between public health and, say, healthcare, it's prevention. Prevention is the primary focus across any entity that you can identify, and how does it relate to public health. In public health, our goal is to ensure that we have clean air, clean water, soil even, through environmental health assessments. So anything that has to do with improving the health of our population is related to public health. Anything you can think of. From environmental to maternal child to infectious diseases to chronic diseases to injury prevention to surveillance. Our epidemiology and immunization services branch, all of the reportable diseases have to be sent in through our department. So any disease you can think of, it's related to public health.
There's some questions about specific skills that they should be working on. Some people are asking about data analysis and what programs for data analysis they should be trying to learn. And others are asking about things like writing and how they can work on their writing. So can you talk a little bit about gaining skill sets? I
think the most important skill set you could have, besides oral, but written skills, that's very important. I feel it's one of the most important skills you can come to the table with. So I would encourage you to do that. You can learn an IT data analysis tool. You can learn that. But knowing how to write, I just think is so important and vital. Not only public health, but anything that you do, but it's definitely important in public health. Because being able to take something that's complex, analytical, and translate it into Joe and Susie public speech is important. Otherwise, if you can't translate something that's complex into simple language, then the general public won't understand, and it actually will confuse them in actuality and make things worse.
I will say, just from a kind of, again, a university perspective, depending on the concentration and the interest and track you take, you may get more or less of a certain area. So if you want to be in epidemiology or biostatistics, you're going to get heavily into analytic skills. If you're engaged in policy, obviously, maybe it's writing briefs or engaging in advocacy and so on. So I think some of that depends on the interest. I do think, especially with an MPH, depending on what degree we're talking about, you get a pretty broad skill set, right? You get a core set of classes, and then I think schools that are accredited will ensure that you are getting a good experience in writing and analysis and so on. And then beyond that, students usually build on that framework, right? They say, I really want or need to learn GIS, right? How to map things. So they take that, and sometimes maybe that's an elective, or somebody's really interested in infectious diseases, so they take a class around that. So I think there's some flexibility around that, but I do think, at least for an MPH, for example, it's almost built in that you're going to get across a very core set of competencies and engage with that material. Other degrees depend. Some are more specialized than others. I won't go into all of that.
Excellent. There's some questions about people who didn't study public health as an undergrad, but are hoping to get an entry-level position or some experience in public health before going to get a master's. So do you have any tips on what they might be able to highlight or to be able to get into those kinds of roles to get the experience they want?
I can share one experience from a student that came to us as a volunteer in our Office of Board of Health when she was an undergrad. And she is still with the county and now has basically transitioned to a very high level position, but she has been with us, was with public health for the entire time, from being an undergrad to going to get her master's in public health, even after that. So there are opportunities. You just have to have the passion and the will, and you have to have good working relationships with the people in the health departments that you're interested in working in. And it's possible. And you learn so much that you probably didn't even have an idea that you would learn, depending on who your supervisors are, because they ultimately become mentors. I became a mentor to this particular individual as well. So I would encourage you to do that if you're interested.
I would also think about what do undergrad public health majors sort of get in their pathway that you may have not. And typically, if you look at the curriculum, it's a lot of science, it's some math, it's some statistics, it's maybe some communication. So consider, again, how are you getting some of those skill sets in other ways? direct experience already or through other coursework, because it's not necessarily about the end all and be all that you have to have a public health degree, but maybe if you have a physics degree, again, you've engaged in a bunch of deep thinking and visual, so I don't think you should ever rule that out. And the same thing when people apply for grad school, they're not everybody's a public health undergrad, and that didn't exist in my day, right? We were all different majors, a lot of biology majors. So that I think just consider again, what does that pathway look like? You can very easily see what that curriculum looks like for a typical kind of undergraduate public health major.
Thank you. All right, there are so many questions and we're running short of time, but I just want to leave you with one. And if there's something that you wish you knew before you started down this path of your public health career, what would you tell your younger self?
Interesting. Probably the politics. I actually was interested when I was in undergrad, obviously always interested in going to medical school, but I was interested in sports medicine. So that was my experience where I shared with you. I just called an orthopedic surgeon out of the blue. But the politics as you go along in your career path, I think it's important to be aware of politics and the political acumen of your institutional environment. And I don't think I learned that along the way. So there were no missteps for me, but now going back, just being aware of those things in advance probably could be beneficial to people. Thank you.
Ashley, you go ahead. I think they're going to know from you. You just recently graduated.
Oh, I think if I could start all over again, I just would remind my younger self that when you're studying public health and you're in the program, that program is, you get to decide what you get out of it. And so put yourself out there. Really don't be afraid to ask for what you need, and talk to people and be transparent about the things that you want to gain from your program. Sometimes you won't be able to get everything that you're asking for, but if you don't ask at all, you won't get anything. So don't be afraid to put yourself out there. I think that's the most important thing.
I'll say just quickly that I think, I don't know that I haven't or didn't do it, but I think just the importance of also not just engaging with your faculty and community partners, but your peers. Think of that network that you're developing as you go through and the importance of that and what they can offer as friends and as colleagues and future colleagues. And then as you move forward, right? So maintaining some of that. And I think that can be challenging, obviously, when you get very busy with life and so on. But I think that's something really important because they're your future fellow leaders in this field. So the people to bounce ideas off of and to know people in other high places and so on.
Excellent. All great tips. Well, Alicia brings up the final slides. I do want to say a couple of things. Some of the questions I've seen have related to the types of degrees you need an undergraduate to study in master's in public health. And the great thing about public health is we need people with all different backgrounds. So there's not one requirement for specific degrees. So I know one specific one was like a Bachelor of Science in exercise science or something like that. You're definitely eligible. Also, as a reminder, the webinar will be provided on this link within a few days. I put it a few times in the chat as well. So check back. I think you'll also get an email about it. And next slide. There are so many questions about the mechanics of applying to grad school and how do you find your right fit in the types of degrees that you can get. So I just want to remind everybody, check out thisispublichealth.org/events. We have events coming up. These are a couple, but we are adding a full slate of events this fall to meet with our member institutions and talk to them specifically about their application process. So definitely check this out and we hope to see you at some more of these events this fall. And again, I want to thank all of our speakers today and all of you for attending from all over the world. It was amazing to see where everybody was coming from. So thanks so much for everybody's time. And I look forward to seeing you on another webinar soon. Have a great day.